Hi, I'm Stephanie.
And I'm Peter.
And we're with DAC, Drug Awareness Committee. Our mission is to educate children, teens, and adults about prescription drug abuse, poison control, and opioid medications.
In this video, we will be educating you on the dangers of opioid overdose and the proper use of NARCAN. We hope you enjoy this presentation. Before we can help someone experiencing an accidental opioid overdose, here are some key differences between side effects, sedation, and an overdose. A person experiencing an opioid overdose will have difficulty breathing, will not respond to any shouting or shaking, and will have very small pupils. If you suspect that a loved one is having an opioid overdose, you may be able to reverse this by using NARCAN nasal spray, an opioid reversal agent. First, identify if the person is experiencing an opioid overdose by checking if they respond to stimulation. You can shout their name, shake their shoulders, or firmly rub the middle of their chest with your knuckles. Also, check for other signs of an opioid overdose as previously mentioned, such as difficulty breathing or small pinpointed pupils. Once an overdose is identified, lay the person on their back to receive a dose of NARCAN nasal spray. To administer NARCAN nasal spray, hold the device with your thumb on the bottom of the plunger and your pointer and middle fingers on either side of the nozzle. Gently insert the tip of the nozzle into either nostril. Tilt the person's head back and provide support under their neck with your hand. Press the red plunger firmly to give the dose of NARCAN nasal spray and remove the device from their nostril afterwards.
Finally, get emergency medical help right away by calling 911. Move the person on their side into recovery position so that their hand supports their head and their knee keeps their body from rolling onto their stomach. If the person does not respond by waking up or breathing normally within 2 minutes, an additional dose should be given in the other nostril. If you or a loved one are taking opioid medications, you can request NARCAN from your healthcare provider or by accessing the electronic application provided by the California Department of Healthcare Services. Lastly, here are some tips to prevent an accidental opioid overdose. Avoid taking opioids with alcohol, a class of drugs known as benzodiazepines, or other medications that can make you sleepy. Talk with your doctor or pharmacist if you miss or change doses, feel sick, or start new medications. Thanks for watching. If you have any further questions, reach out to your healthcare provider or local pharmacist.